Hello and welcome to this two-part video series on back pain. My name is Apni Bharang. I'm a recent graduate from India, and with this video series I hopefully have curated material that will help us as providers to help our patients better and educate them better regarding back pain. So yeah, let's get right to it. Back pain, as we understand it today, is one of the most common complaints to arrive in the emergency department or the OPD for that matter, and it causes significant amount of disability to most of the patients. However, it's very necessary to be able to differentiate the alarming causes of back pain from the benign causes, which can be treated supportively. And hopefully in this video, we will be able to delineate those causes and understand the presentation of those particular causes. So the International Association for the Study of Pain estimates that about 7.5% of the global population afflicted with low back pain in 2017, and that estimates to be about 577 million people. That is a staggering number. It's a perfect segue for us to really understand why so many people suffer from back pain and how can we as providers be a bridge between providing quality care to our patients and helping them understand the disease process. In this video, we will be studying the following. We will be studying the classification for back pain, and hopefully with this classification, we will be able to understand really how to approach back pain, the review of various subtypes of back pain, again, something that will help us, characteristic symptoms of each back pain, each subtype of back pain to be able to really clinch diagnosis when the patient does present, the pathophysiologic mechanisms to involve a holistic understanding of each disease process, and what is the next step, best step in management for each of these diseases. So for this classification of back pain, I did a fair amount of research. I went through a couple of journals, but to be honest, the best classification for back pain I found in the Amboss library. It's a perfect way to really distinguish each subtype, not only anatomically, but also in a way that will help us approach each diagnostic algorithm differently. Each of them has a different approach and of course different levels of severity. And yeah, so I'd like to share that with you. First is the urgent spinal back pain, non-urgent spinal back pain, non-spinal back pain, traumatic back pain, non-specific back pain, and low back pain. And with this classification, like you can see the way it has been organized, it helps us really get a sense of how we can approach back pain. So let's look at it a little deeper. Let's run a deep dive into this and see how we can approach it. This particular video is going to be discussing the non-urgent causes of spinal back pain, and it's a really broad category, so I hope I've done a good attempt to really narrow it down and make it easy for us as providers to understand each process. So the subtypes of non-urgent spinal back pain are as follows. First is the mechanical type of back pain. This involves injury to the disc, the spine, the soft tissues. Disc herniation today is one of the most common types of the mechanical spinal back pain. Next is the degenerative type, which is most commonly seen in the old and aging population. This commonly involves osteoarthritis of the facet joints or the sacroiliac joints. Next is the inflammatory subtype, which involves spondyloarthritis. This is a really broad category and we will be talking about it in detail. The next is the infectious subtype. This includes anything between anywhere from vertebral osteomyelitis to various types of abscesses, epidural abscesses, muscle abscesses, things like that. And then the oncologic subtype, which involves metastasis to the vertebral column causing spinal back pain. So coming to the first type, mechanical back pain. So now if you have a look at the MRI alongside, you can see that there is this is a picture of a herniated disc, and like you can see here, the disc herniation really causes an impingement of the spinal cord. That's what causes the back pain. Disc herniation today is one of the most common types of mechanical back pain. It presents with a lower back pain that could be referred to the leg or the buttock or the hip. Very characteristically, you will see signs of nerve root compression of the nerve root that is particularly getting compressed here. The explanation given for back pain in these subtypes of back pain is basically that there is the disc per se is not nociceptive. It's basically when the disc ruptures, it causes production of cytokines, and that triggers production of cytokines, and that causes back pain. They refer to it as a discogenic kind of pain. To be able to confirm your diagnosis, MRI would be a good idea. It's the best modality of imaging in case of mechanical back pain. Degenerative back pain, like I said before, is to do with osteoarthritis of the spine, more commonly called spondylosis. This is commonly seen in the cervical and the lumbosacral region of the back and the spine. It presents with pain with extension or rotation, and basically there is a limitation in the movement of the spine, of the back. And degenerative joint disease back pain will improve on recumbency, and that's a highlight of degenerative back pain. When a patient comes to you and says, I feel better after I've taken a nap or I've rested my back, that's when I feel a little better. When you do a neurological examination, you will find that there will be no findings per se. It's a normal neurological examination. To confirm your diagnosis, X-ray would be the best modality. Coming to spinal stenosis, this is a really interesting category of back pain. Like you can see in the MRI here, there is a gross stenosis of the spinal canal here, and we will delve a little deeper into why this is happening and what are the repercussions of something like this happening. So first of all, what is spinal stenosis? It's basically a narrowed spinal canal. The term they use to refer to this in literature, the kind of back pain, it's called neurogenic claudication. It's a very fancy word, but to break it down, it's basically the pain in the back and buttock, and which it increases on walking or standing and decreases on leaning forward, just like you do when you push a shopping cart. And that's why it's called a shopping cart sign. Like you can see in the picture alongside, this pain is relieved when you bend forward. The explanation given for this is that flexed positions increase the anterior-posterior spinal canal diameter, and they reduce the intraspinal venous hypertension, and that produces pain relief. To substantiate this explanation, I found this really nice image online, which does a good job in explaining the dynamics involved in spinal compression because of spinal stenosis. So like you can see here, because there's a flexion of the spine, there is a gross increase in the anterior-posterior diameter, which kind of relieves the compression on the spine and relieves the pain on the whole, as opposed to this side where there is extension but there is spinal stenosis. This is a picture showing you a really basically all the different causes of spinal stenosis, anywhere between a herniated vertebral disc to a bony spur to a compressed spinal cord because of this bony spur. So all of it is summarized in this picture. The best modality for spinal stenosis to be able to diagnose it is to do an MRI. On MRI, not only can you appreciate the anatomy of the spine, but also the different causes causing spinal stenosis, and that should be a great modality for you to be able to confirm and clinch this diagnosis. The next subtype is inflammatory back pain. This picture alongside seen here is a spot diagnosis for most providers, and I feel like it's something that we should know spot on. So to come up with a few clues, I found the explanation to why this actually happens. These kinds of back pain are often commonly associated with something called as enthesitis. Enthesitis is inflammation of the part of the bone where the tendon inserts. Once you have enthesitis, you will have erosion of the vertebrae, obviously, at that part of the bone. And that causes syndesmophytes. Syndesmophytes are basically calcifications that develop around the annulus of the vertebrae. And once that does happen, over a period of time, there's something called as ankylosis that happens. Ankylosis is fibrous or bony fusion of these syndesmophytes. Overall, the picture is that you will see something called a bamboo spine. There's fusion of the syndesmophytes at each level that causes something called a dagger sign. And as you can see here, it's pretty stiff. So yeah, we are talking about ankylosing spondylitis. Ankylosing spondylitis is one of the most common types of inflammatory back pain seen today. commonly presents in young adults who present saying that the pain presents when they are sitting around a lot, presents at rest, and improves when they start doing some kind of activity. Very commonly in the mornings, once they've woken up, it takes them about 30 minutes. The morning stiffness is more than 30 minutes. It takes them some time to be able to level up to their baseline level of mobility. There's a gross loss of spinal mobility. There's a limited anterior and lateral flexion and extension of the lumbar spine, and a limitation of chest expansion over a period of time. The pain and stiffness is due to the inflammation of the vertebral column, and to diagnose this condition, X-ray would be a great modality. Like just like you saw in the picture in the side in the previous slide, that's how you can diagnose ankylosing spondylitis. A characteristic feature of this type of back pain or this type of arthritis is sacroiliitis, which again you can diagnose on an X-ray. Infectious causes of back pain, like I mentioned before, is a really broad category. It includes anything from vertebral osteomyelitis to epidural abscesses to muscle abscesses, abscesses of different kinds. The thing with abscesses, like you can see here, is that they compress the spinal cord at that particular site. These patients classically present with fever, back pain, and a neurological deficit at the site of compression. They very characteristically say that there is an increase in pain in the night. And when you do start examining the patient, they will complain of point tenderness at the site of the abscess formation. That's characteristic for abscess-related back pain. Okay, coming to spinal compression. Spinal compression is often caused because of oncologic metastasis of various cancers to the bone, the vertebra. Most commonly involves the breast, the kidneys, and the lungs. They cause spinal metastasis, like you can see here. They cause vertebral metastasis, which impinge on the spinal cord and cause back pain. This back pain is very characteristically seen that is worse on recumbency. The patient will come to you and say, it's worse in the night, it's worse when I lay down, and the explanation given is the compression of the epidural plexus of veins. There is an increase in nighttime pain, and the best way to diagnose this condition is MRI. So yeah, this was our video on non-urgent causes of spinal back pain. I hope I kept you hooked on and engaged for this. The next video would be on this very intimidating chart. And yeah, I hope I can break it down for you. We're going to be talking about these conditions, and I hope I can break it down for you piece by piece. And yeah, something and learned something as we walked through this video. And I hope you had fun listening to me as much as I had fun making this video. Thank you so much and have a great day.